So thank you for joining us this evening. We are very excited to be hosting some guests. We actually have Rebecca MacDonald here with us. She is from the Shine service, which is a service, or Shine, which is a service of the Senior Connection Center. And Rebecca, I'm going to let you help me with the acronym of what Shine stands for. It is
Serving health insurance needs of elders.
very much. Yes. So that is what we have. And she is an expert who can talk about the Medicare application process, which is what we will be talking about tonight. Before we get started, I do want to let you know a few things. My name is Amanda. I'm with the Tampa Hillsborough County Public Library. We are bringing you virtual programs throughout the summer and going into the fall. If you want to learn a little bit more about our virtual programs, we're going to put our link into the chat section. That's hcplc.org. You can also do hcplc.org/contact. And we will be sharing other links in the chat section as well. So without further ado, I am going to pass it over to Rebecca MacDonald. Thank you so much.
Thank you. Well, hello everyone. And as Amanda said, this is about Medicare. So we're going to start with the most basic explanation of Medicare basics. Medicare, the SHINE program, I'll explain a little bit about the SHINE program. It is one of the many programs and things that the Department of Elder Affairs has for Florida seniors to age and stay at home for as long as possible to just maintain their independence. And our purpose is to provide free and unbiased counseling and so that you can get your health insurance information and make informed choices, because a lot of people just like throw darts and pick their insurance plan. So it is a free program. We're not an insurance company. We don't sell insurance. We just give you the information and the tools to make your own decisions about your health care. All of the programs and resources that are available through the Senior Connection Center, which is one of the many disability resource centers. So if you don't leave with anything else tonight, please write this number down: 1-800-96-ELDER, 963-5337. Because if you get to 7:15 p.m. tonight and say, what did she say? This is the number you can call and say, she said something, I don't understand it. I'd like to have somebody, explain it to me. So that's where you're going to call to get the help that you need, explain our program, or if you have your mom want to call and get some help with her Medicare. As she said, SHINE is an acronym that stands for Serving Health Insurance Needs of Elders, and we counsel and advise and give information to people about anything that has to do with original Medicare, which is your hospital, which is all there used to be, hospitalization and medical benefits. Now they have Medicare Advantage plans, which is your Part C. Part A is a hospital and Part B is medical. Medicare prescription and drug coverage is Part D. So you can see there's like 4 parts to Medicare. So tonight we're going to try and get us through original Medicare, and then we are having another program Thursday night that will go a little more in depth for Part C, the Medicare Advantage plans, and the drug prescription coverage. The other thing we'll talk about a little bit is Medicare supplement insurance that people get, and what it is and why they want to get it. Extra help for prescription drugs is one of the financial assistance programs that we help screen people for, and it helps people with their drug premiums and low-cost prescriptions. So I think that is in one of the handouts, and when you get there, you might want to just download that or print it out so you can see. And if you feel like you or you know someone who might qualify, if they're in the neighborhood for the assets and resources, please give us a call at that number, and we're happy to see if somebody's eligible. Medicare fraud and abuse, the SMP on our logo there stands for Senior Medicare Patrol. So we actually have more specially trained volunteers within our volunteer group that will devote their time to Medicare fraud and abuse, back braces, and now there's a lot of COVID-19 scams going out there now. Medicare Savings Program is another financial assistance program that will be on the page that you can download. That's with this. That's from the Department. DCF, and that helps with Part A and Part B premiums. So this is for people of low income and assets, but some people that don't have it and they're eligible for it, it could be huge. Long-term care planning, we have a lot of people at the Senior Connection Center that can help and counsel people for long-term care planning. So if that's something that you say, we got to make plans for mom or dad or somebody, give us a call, talk to one of our long-term care planners. Complaints and appeals, we can help people if Medicare denies something. So what is Medicare? Medicare's federal health insurance for individuals. There's no family plan or spousal coverage or anything like that. Every person has their own specific individual health insurance coverage. It's administered in Florida. It's called the Centers for Medicare and Medicaid Services. I guess we're all in Florida. Sometimes I talk to people from other states, but the CMS, this is the official logo. So this is on anything that you're going to get mailed to you from Medicare, Medicare New Handbook and stuff like that. So you get a lot of mail that says important announcement from Medicare or something like that. If you don't see this logo, then it's not officially from the Center for Medicare and Medicaid Services, which is who administers our Medicare services here in Florida. You start out by enrolling in Social Security. So Social Security is involved at the beginning because they're the money part of it. So you enroll through Social Security, and once they've got you all set up there, then everything else basically comes through CMS. Social Security is still taking your money, but CMS is the one that administers it. So to be eligible for Medicare, you need to be a United States citizen and age 65. And just like everything else, there's always exceptions to every rule. So in people that have been legal permanent residents for 5 continuous years, keyword being continuous years, that you're eligible to have Medicare A and B. Individuals receiving Social Security disability income, and it has to be getting that check from Social Security disability for 24 months, and then you're eligible to have Medicare A and B. So that's why sometimes you'll be talking and say someone obviously not 65 says they have Medicare, and it's probably they got it through disability. So that's and it has to be getting that Social Security check. Individuals with end-stage renal disease, meaning you need to be on dialysis or you require a kidney transplant, or individuals with ALS. There's no age limit for those individuals, and they can get Medicare at any age. So to enroll, we get this question a lot: how do I enroll? If you are already getting a check from Social Security, maybe you started getting partial Social Security to age 63 or whatever. If you're getting a monthly check from Social Security for any reason, when you turn 65, you will automatically be enrolled in Medicare Part A and B. You'll get a little packet of information from Social Security. It'll have your card in it and all your papers and explain it to you like that. If you're not getting any Social Security payments, but you do want to have Medicare when you turn 65, then you have to voluntarily enroll during an official Medicare enrollment period. And we'll go over that a little more in detail in the next slide. So most people are trying to wait, to hold off on Social Security, but they still want to have Medicare. So if that's the case, you just call Social Security and you enroll during one of the official enrollment periods, and then Social Security bills you and you just pay. I think they bill you like 3 months at a time. So the initial enrollment period has to do with your 65th birthday. And like I say, the next slide goes more in detail. If you miss your initial enrollment period, which has to do with your 65th birthday, then you have to wait until the general enrollment period, which is January 1st to March 31st, and your coverage doesn't start until June. So you can see there's a lapse in there. So if for some reason, and just for an instance, if a person was incarcerated, they don't have Medicare when they're incarcerated, and they missed their initial enrollment period when they turn 65, and then they're released from incarceration, and they have to wait until January. So they're going to have to find some other kind of health coverage because they don't have anything built in for that. And special enrollment periods. That person who had been incarcerated would not be eligible for a special enrollment period. However, if you're working when you turn 65 and you have insurance from your employer and you say, I don't need Medicare right now, thank you. And you tell them that, you're going to keep working and use your employer's retirement. And then 6 months later, you decide you're going to retire, you're entitled to a special enrollment period. You do not have to wait until the general enrollment period. You have a special enrollment period, and you can go ahead and apply for Medicare. So you're not penalized if you just don't take it because you're still working. These are all questions that Shine counselors can help you with. And every person has unique situations, but if you don't know the answer, it's not a stupid question. So the initial enrollment period, as we said, has to do with your 65th birthday. You can enroll in Medicare anytime in the 3 months prior to your birthday. And if you do that, your coverage starts in the first day of your birth month. If you wait until the month after, it doesn't start until the first day of the following month, so forth and so on. So everyone knows when they're going to turn 65, so it's to your benefit to go ahead and enroll anytime in those 3 months, and then your coverage will start on the first day. So this is one of the things that you could print out. This is a handy thing that they actually did come up with. As we said, there's like the 4 parts of Medicare. So you're going to get your coverage kind of, in some combination one way or the other of these 4 parts. And what we're going to talk about tonight, the path, there's 2 ways you can get it, is this left side or the blue side of the page, which is your hospital and your medical. So the 2 paths, original Medicare, which is all it used to be, which consists of Part A or hospital coverage that has to do with inpatient hospital coverage. You have to be admitted and be an inpatient. Otherwise, you have Part B, medical coverage, which takes care of everything else. And tonight we're going to go into those a little more in detail. Optional coverage under original Medicare includes Medigap, which, as it says, is a bridges Medicare cost gaps because Part B pays 80%, and sometimes you have things that are not covered. So some people like to get Medigap, which is through a private insurance company, just to make sure that they don't have to pay anything other than their monthly premium to the Medigap company. Part D, or the prescription drug program, is part of they say optional. It's only optional if you have other coverage. But for individuals that don't have any prescription drug coverage, Medicare really wants you to have this coverage, just like they really want you to have hospitalization or medical coverage. So if you don't take the Part B and you don't take the Part D and you don't have other coverage, there is a penalty enacted, like 1% of the cost of living or something like. They have some little formula. It's not hundreds of dollars, but if you wait 5 years, you're going to be paying more for your premiums than your neighbor who got all of his stuff at age 65. So that's just something to remember, because I have people tell me, I wish someone had told me that. So the other side is a Medicare Advantage Part C, which is your HMOs and PPOs, and we're going to talk about those a little bit more next week. So today we'll just kind of discuss original Medicare. So we said original Medicare Part A is your hospital coverage, and the rule of thumb, or to be considered an inpatient hospital, you have to be 3 midnights. So even though it seems like you've been laying in the hallway of the emergency room for weeks, if you haven't been formally admitted and spent 3 nights, it's not going to be considered an inpatient coverage. You'll be covered by Part B, or medical coverage. So Part A covers inpatient care. It covers blood after the first 3 units. You would need to pay, you are responsible for the first 3 units unless you have a Medigap policy that pays for the first 3 units of blood. Part A covers you for skilled nursing facility care. So if you go in with a broken hip and you're in there for 5 or 6 days and then they discharge you, then you go to the skilled nursing facility. Part A is still covering that because you qualified for inpatient care in Part A. It also covers home health if it requires skilled nursing care. So if you go from skilled nursing facility home and you're still getting someone in for complex dressing changes or receiving physical therapy or something, the Part A is still going to keep covering that. So that's why it's important to know what your status is when you're discharged from the hospital, and it covers hospice care. Everyone should be advised of what their status is, but a lot of times there's a lot of papers and you're trying to get your plants in the bag and everything else. So it's just a good idea to ask someone, am I considered an inpatient? Because then if the hospital doesn't say that we're not going to bill Medicare, and then you realize, oh, I was only in overnight, so it wasn't an inpatient. So it's just good to know that information. This is one of the other handouts. This just shows the different configurations that you can have, original Medicare with a Part D plan. This might not make too much sense to you now, but hopefully it'll make more sense to you after we've gone through the rest of the program. But getting back to Part A, the other thing about Medicare, original Medicare, is that you can go to any provider that accepts Medicare. With the Medicare Advantage plans, the HMOs and PPOs, you need to go to their network of physicians. So if people are traveling out of state a lot, maybe they're going to this somewhere for 3 months and somewhere for 4 months or something like that, they're usually better served by having original Medicare and a Medigap, because they can go anywhere and they can go to any provider that accepts Medicare. And that just means when they say they take Medicare, that they have a contractual agreement with Medicare to accept what Medicare allows for that certain whatever services they're providing. The beneficiary cost in 2020 is premium free for most people. People that have any kind of a work history with Social Security, then Part A is free, work long enough for it. But if you haven't got any work history, then people do have to pay a premium for Part A. I think it's like $200 or $300. They don't know right offhand. There is a benefit period deductible for Part A, and that's $1,408. And a benefit period deductible is from the day you're admitted through 60 days after you've had the last skilled nursing care. So you go back to the nursing home, go back to the hospital with the broken legs, Part A, go to skilled nursing facility, you're still covered by Part A for that benefit period. You go home and you have some complex dressing changes or something, and so you're still getting some skilled nursing care at home, and then they stop that, you're better, so you're just home. Your 60 days starts from that period when you're no longer getting skilled nursing care. So if you go back to the hospital sometime during that 60 days, you do not have to pay another deductible. But if you have to go back to the hospital on the 95th day, then you start another benefit period and you have to pay another deductible unless you have a Medigap policy that takes care of your Part A deductibles. So it is possible for people to have to pay 2 deductibles for Part A. Additional copays after 60 days of inpatient coverage. So there's no copay up to 60 days. And then unless you have a Medigap policy that takes care of that copay after you've been in the hospital for 60 days. Different costs or other Part A services, but for the most part, Part A takes care of pretty much everything is covered under a hospitalization. And as we said, the financial assistance is available for Part A and Part B premiums. That's that Medicare Savings Program. So, let's see. So Part B then is anything that has to do with not being in the hospital. It's all of your doctor's visits, all the doctor services, inpatient care, outpatient surgery, physical therapy, home health services, durable medical equipment, walkers, wheelchairs, canes, the insulin supplies are considered durable medical equipment, and preventive services. There's a long list of preventive services that Medicare covers at 100%. So when you get your Medicare New Handbook or you're looking online at the Medicare.gov website, it's a good idea to look through what preventive services are available and have that conversation with your primary care doctor. Well, we have a family history of this and I'd like to have a test for it. Get it, and then you don't have to worry about it anymore. So pretty much everything, if you're not in the hospital, then Part B takes care of everything else. With Part B, the cost, there's still a few people paying $109. Um, that's because they're low income, and if their social security check is not enough to cover the difference between 109 and $144.60, which is what we're paying now, then they stay at $109. Otherwise, they'd be going backwards on their social security checks. But most of us pay $144.60 a month for the Part B. That's the Part B premium. Whether you have original Medicare or you have HMO, PPO, whatever, we still have to pay the Part B premium. I'm guessing it's going to go up a little in 2021, but for now it's $144.60. And with Part B, you have an annual deductible of $198, which means that the first few visits in January of a new year, you are going to have to pay some money out of your pocket for the deductible unless you have a Medigap policy that pays for the Part B deductible. So every provider handles that a little bit differently. But if they ask for money and it's the first time you've been to the doctor in the new year, then they can do that. Part B is covered up to 80%, and you're responsible for the other 20%. So if your doctor's visit is $100 and Medicare says we allow $100 and the doctor as a provider has a contractual agreement, then they're going to pay that doctor 80% of what they allow so that he gets $80 and you're responsible for 20% or $20. If Medicare allowed $200, they would pay him $160 and you would owe $40. So sometimes you don't know what's allowed for that particular service. Most surgeries, they know exactly how much, your portion's going to be. But if you just have Medicare Part A and Part B and no Medigap policy, then you do have the 20% co-insurance on most of the Part B services, which if you only go to the doctor once a year, it's not going to be too much, but if you have a lot of CAT scans and MRIs, it could be, get right up there. So I'm just going to see, has there been any questions that have come up during this time, Amanda? I mean, as people seem to be understanding what I'm saying.
We did have a few questions. So I will
Okay.
bring up the first one, and I'm actually going to type it as maybe, or even if we can go back to the slide, if you can repeat the number for Shine to contact Shine.
Oh, yeah, yeah. The 1-800-963, yeah. It's
Uh-huh.
1-800-963-5337.
Okay.
Yeah.
And then I'm going to put that in the chat section. That is the, to repeat it, 1-800-963-5337. And that is the number to contact Shine.
Mm-hmm.
And then one of our other questions, I think we'll have time if we want to go on with a few more slides. So
Okay. Well, actually, I really only have Medigap. I just realized I stopped too soon. I think we'll go on here a little bit farther. So, original Medicare and Medigap. So all of the, excuse me, all of the times that I said, unless you have a Medigap policy that covers that, that's what the Medigap policies do. Okay. Now Medigap policies are through private companies. They're not nothing to do with Social Security or anything like that. So you have to search them out and find them. And sometimes people get it's a little confusing because there's a lot of them, and they can range anywhere from $200 a month to one with all the bells and whistles to like $700 or $800. Well, I don't think there's any that expensive, but the reason it's complicated is because they gave them all alphabetic handles here. So I don't believe Plan C's, there's not quite this many offered. There's 2 or 3 of them that aren't going to be offered next year. But each plan has different benefits. All of them have 4 basic benefits. All of them, no matter what plan you get, has the Part A hospital copay, which like we said, if you're in the hospital for more than 60 days, you would start paying a copay. Hospice care, Part A hospice care, Part B copays. So if you didn't want to worry about that 20%, you could just get, the most basic Medicare supplement, and it would take care of that 20% and the first 3 pints of blood. So we don't have a chart of them here, but if you go to medicare.gov, or if you have a Medicare new handbook and just Google Medicare supplement types, it's going to hopefully show you a chart so that you can see under Plan A what its benefits are. One of them has a little bit of foreign travel. And so if you're going to get a Medigap policy, the best thing to do is to look at that chart and figure out which Medigap policy is the best for you, and then start shopping around, because this is where there's a lot of competition. So Plan A, if you decide I'm going to get Plan A, the benefits are going to be the same no matter who you get it from, Company X or Company Y, but you're going to pay less with Company X. So with Medigap, so it doesn't matter. So you do have to shop around a little bit. Anyone with Part A and B is eligible. Medicare Advantage plans, Part C, you can't use a Medigap policy. Open enrollment. The best time to get the best price for a Medigap policy is in the first 6 months when you start with Part B. That's when you start, not when you're 65 and eligible, but when you're enrolled, when you're going to start Part B, 65, 72, whatever, for the first 6 months, you can get a Medigap policy, and you can't be denied or charged more due to pre-existing conditions. So that's the best time to get the best price for a Medigap policy. After that, you can buy a Medigap policy anytime, but once you're past that guaranteed issue rights, you're subject to their medical underwriting. So then they can start charging you more for age and for whatever conditions you have. So that's where you have to give a little thought, what's going to be your lifestyle. You're going to be traveling a lot or not so much. Uh, just what's going to fit you best, whether you want to have I have a friend that just said, I just want to get a Medigap policy drug plan and not pay them. I don't have to pay anybody. I don't have to pay any providers. So she's got a Medigap policy that takes care of everything, and she pays them, and she doesn't have to worry about anything else. So these are things that we can discuss with you as Shine counselors and kind of find out what keeps you awake at night and what things you're worried about. So I am going to stop here at Medigap, and I do think we have time for a few questions. I forgot to
Okay,
ask the questions about what county you're from too. So,
right. So we'll get to those questions and we'll see if we
okay,
can
good.
squeeze in the others. We'll go. So our first question is, and I do want to let people know we really can't answer specific case questions. If you maybe you can call Shine if you're not
Yeah.
sure, but we're going to kind of try to answer general questions. So the first question would be, it's kind of about if somebody is on, if they're retired but on their spouse is still working on they're on the spouse's insurance policy who's still working.
Hmm.
If they're over 65, will they then, since they've passed the 65th birthday, will they have to wait for that January 1st enrollment
No,
date?
no,
Okay.
that's the special enrollment period I was talking about because you have what they call credible coverage. So you've got coverage and Medicare's happy, so they're not going to penalize you. So when your husband retires, and he has his health insurance, ends on the last day, then the next day you'll both want to go ahead and start with your Medicare coverage and Medigap coverage or whatever you're going to choose.
Oh, okay. And then this one is, let's see. Well, this one is about if they are not able to print the handouts. Actually, what we can do is we can turn those into PDFs. I have another moderator. It might be a quick thing right now. Chris, if you're able to turn those into PDFs, the PDF web link, we can share those links in the chat section. If you're not able to do in time, we can send those web links as well
And
after the.
you could call this that number and just say, I heard this presentation and I wanted some of the handouts, and our people will put them in an envelope and mail them to you.
Okay, so we do have a couple backups there.
Yeah.
So then this one is, let's see, a little bit specific, but I think it's general enough that we can go with it. If, for example, somebody suffered an illness like a stroke and they were able, if they spent 30 days in the hospital and then 60 days in a skilled nursing home, and then they get long-term health care when they go into their home, what day would be the start date for the skilled nursing home? Would it be the day they were admitted to the
I,
hospital?
to be honest, I would actually have to sit down and figure that out and research it. So I don't want to give you an incorrect answer. That is a specific, and that's why I was saying, like sometimes we have to do a little homework too, and to be able to give you the right answer. And I don't want to just tell you something off the top of my head because you do have a lot of elements there. So
And
um, if
they
it's
do
a
have.
question, the Shine counselor can help you.
Wonderful. And then just a quick question. So right now, because we're in a time where a lot of things are we're doing this virtually where we would normally do at the
Yeah.
library. So Shine, can they do it fully over the phone, or can they do virtual meetings, or what would be the process for that?
Most of the time, well, most of the time work is done over the phone. When we could, we did have face-to-face meetings in the office, but generally most of our done can be handled over the phone. And we are now starting, I know they're talking about it and trying to get some counselors that it would be comfortable with doing it through Zoom or virtually or something like that. But if it was something that we couldn't resolve over the phone, we would certainly figure out some way to make sure we don't give up till we get to some kind of a resolution. So
Okay. We have time. Well, I'm gonna say thank you to Chris, our backup moderator. He did put the link in the those handouts. If you can't download them, you can click the link and it's gonna open it as a web link. So you can look at it on the website. It's just a hosted web link for the PDF there. So you can go ahead and click on that and you'll have that. And then we do have one more question and then we'll go ahead and wrap up for this session, which is about your primary care physician. So when you switch to Medicare, are you able to retain the doctors you were going to, or does it depend if they take Medicare, or do you have to?
If you go with original Medicare, most of those physicians will be in Medicare. There are not very many doctors or providers that don't take Medicare. So yes, if you wanted to keep those specific doctors, you could keep them as long as they took Medicare. If you go with a Medicare Advantage plan, then you are limited to a network, which is still okay as long as your doctors are in the network. So that's something you need to know before you make the decision to go with Medicare Advantage.
That
But
is a good, you
I
might want
don't
to
know who doesn't take Medicare, but I guess there's a few.
do the research. So I do want to say, so we have come to the time for tonight, but I do want to remind you in the link to register for the Thursday night class, we're going to be back with Rebecca MacDonald at 6:30 on Thursday. If you are watching this live, 6:30 on Thursday for Medicare, and that is going to be part C and D, and a little bit of the difference between the two plans. So I do want to thank you so much for joining us tonight, and we hope to see you on Thursday.
Goodbye. Thanks for listening.